forward. All right, and once you pass your phone over to the side there, over there. You'll hit the ground with that thing, eh? All right, so let me see these. All right, so hold that for me. Hold this one.
Oh.
Hold this one.
All right.
Good. So once you put your elbows on your side, just like here. That one too. It's around towards the back. All right, so we're going to unwrap this. And we're going to leave this off for just a few hours, okay?
Okay.
I'm going to have you put this back on later today. It does not need to be tight, just a little bit snug. You need to wear this every day for the next 2 weeks, taking it off only to shower. And you'll need to wash this also. So when you wash it, you want to unravel it, put it inside of a pillowcase, and then wash and dry it in the pillowcase.
Sounds good. I told my dad that I was skeptical that this wasn't just the best binder in the world.
You don't like these?
No, I mean like that
He loves it.
Everything's still under there.
Oh. Nice. Let's go.
No, I trust you, just my brain.
We have the weights to prove it.
Yeah.
Oh, everything feels so light. Oh. I accidentally tugged on the right drain.
You know, people do it all the time.
Okay.
Still, some people yank it out by accident.
Oh, okay.
Which is...
Yeah.
Not all right.
I don't think I did that.
That would hurt like hell if you did it.
Okay.
You would have ripped the stitches out and would have been bad.
Oh, it just tugged.
You just look up for me so I can see? Thanks.
Sorry.
Dad, if you feel any lightheadedness or anything like that, let me know. Okay? I don't need you hitting the ground.
Okay.
I've had it happen before, so.
I'm sure.
Okay.
I'll be watching the chimpanzee.
Whoa.
Alright. Looks very, very good. Let's take a look at the mirror, okay? So, big difference.
Yeah.
You can see, you got your typical ripples, wrinkles, stuff you're going to expect to see initially after surgery, which is going to go away over the next several weeks. Don't worry about that. Tape strips, you want to leave these on for another week. If they don't fall off by next week, then you can peel them off, and it's okay to start to use scar guard on the incisions. Nipples are in the lower outer border of the pectoralis muscle where they should be. You got pretty good pec development already, which is great. On the side, should not have any pucker or anything like that. Looks nice and flat. Looks very, very good.
Nice.
All right?
Cool.
Okay, go ahead and have a seat. So I want you to scoot your tuchus back as far back as you can go.
Easier said than done.
Okay, and just hold on to those for me then. I'm going to raise you up and lay down flat.
They're really gone.
They are really gone.
I was asking you if it was going to feel lighter. It does. A lot lighter.
It's like close to 3 or 4 pounds of tissue, so.
Yeah, actually what you gave me
5.5.
you weighed 5.5.
Something like that. Yeah, well, that was just our gross, weight setting back.
It's really tight.
It's totally normal. I'm not going to do anything, don't worry. But the pathologist does the final weigh-in, basically. Bring that elbow out to the side also. They do that in the lab.
It hurts like right here.
Right here, you mean?
Yeah.
Yeah,
Not like that incision right there.
Oh, I mean, that's normal. You're going to feel that, so. Yeah, I'm just going to have you kind of back up if you don't mind, Dad. You have to stay back. I need free access to both sides of the bed. Like, that's your best spot. Is either right there or in the corner. That's fine. I'm going to be walking back and forth. I don't want to stab you by accident. It's not
That's a
like,
good idea. Okay, so what we're going to do is I'm going to have you turn your head away from me. Okay? What you're going to do is take a deep breath in and blow out, and when you blow out, I'll take the drain out. Okay? So let's take a deep breath and blow out. That's it. Drain's gone. Okay? You okay?
Yeah.
All right, so the same thing. Deep breath, blow out. That's it.
Oh.
You felt that one? Okay.
Yeah.
What are you feeling?
Yeah,
What is it that...
Can you explain how the drains work?
What's that?
Can you explain how the drains work?
They basically suck fluid out. That's all.
So how far do they like go in?
Oh, they're in about 6 inches.
Oh. Okay.
Now there's a tiny hole at the end of the incision. You need to cover that with a bandage and some antibiotic ointment once a day. It takes about a week for it to close up, and it will leak some fluid, so don't be alarmed.
And the stretch I feel right now is okay.
Totally normal. Your skin's going to accommodate over the next few weeks, and eventually you won't feel that tightness anymore. And you can bring your arms in like this. There you go, perfect. Now, the nipples always look a little gross initially. The outer layers will peel away over the next week. New skin cells are going to grow over on top of it over the next couple of weeks. And the nipple projection typically returns after several weeks. I'll show it to you in just a second.
And feeling as well.
Feeling can take up to a year to get sensation back. And most patients get back the sensation of touch to the chest. You'll start to be able to identify that that's actually where your nipples are. Some people claim they get pleasurable sensation back. I don't promise that. It doesn't make any physiological sense. Alright, so if you take a look down, you can see here's the areola. There's a nipple in the center, so fat and flat. Eventually going to project out a little bit. These little brown sutures in the periphery are going to fall on their own. Even if the edge like that's normal, that usually stops after about a day or so. But that's very healthy and alive. Okay? You can go on that side now if you like. I'm not going back over here.
Do you not have like feeling inside, like where the drain was? Because I felt like the pressure, but I didn't feel like, it felt like it was numb.
Now those different types of nerves in different areas, they get sensations for different things. So usually you won't feel the actual drain inside, but you're going to feel the, you know, the movement or tugging and stuff like that. That stuff you will feel. This one looks good too. Looks healthy and alive. So you can start to shower tomorrow. Let the water hit your back and run over your chest. Do not face the shower jets because you can damage your nipples. Okay? Then when you get out of the shower, you want to pat yourself dry with a clean towel, and that's when you do the dressings. So we're going to give you 2 sheets of yellow gauze called Zero Form. That's in these little foil packets in the plastic bag back here, and I'm going to give you enough to last you the entire time. You're going to do this dressing once a day for 3 weeks. Okay? So what you'll do is you're going to cut 2 squarish pieces like so. You put 1 on top of each graft. Get some antibiotic ointment like Neosporin or Vaxotracin. You put a little dab right on top. You spread that on top, just like that.
I really feel.
Yeah, you're going to be numb there for a while. Usually you have some sensation here, but down below here you're not going to have any for a while.
I can feel here.
It's totally normal.
Okay.
Now I'll cover this with gauze. I recommend you buy those big square band-aids. You peel them open and put them on top. It's just a lot easier. This way you're not dealing with all the gauze and tape.
Okay.
Now for the next 2 weeks, you want to take it easy. No strenuous activities, no heavy lifting, keep your arms down by your side as much as you can. After 2 weeks, you can start to use your arms a little bit more. But still, no heavy lifting, no exercise for 6 weeks.
Okay.
If you run into issues between now and that time period, I want you to call me right away. And that is pretty much it.
So in like a couple hours, I put the thing back on?
Yeah, a few hours from now, 3 hours, 3-4 hours. Your skin breathe, have this thing on for a week, you know, it's nice to get some air on it.
I'm not allowed to itch right now.
Be careful when itching because you are going to have some numbness and you can actually damage your skin by scratching too hard and cause some problems.
How
So,
about like this?
yeah, I mean, I think you're fine there.
The
Yeah,
itching is
just-
going to go away too over
It's so
time,
You can
right?
actually hurt yourself.
He
But
had
like, I
a
can,
lot
like-
of itching yesterday night.
Yeah, it tends to